Substance abuse. The good, the bad, the ugly. Substance abuse is overuse or misuse of a drug. Let's say that you know that you can count on me to bail you out of any financial bind your gambling gets you in. And let's say that twice a week you are hitting me up for money. This will be abuse of a friend's goodness. Substance abuse occurs when we constantly turn to drugs to cope or out of addiction. Admittedly, abusing substances such as drugs and alcohol gives you a certain pleasure because it satisfies certain desires. It helps you escape certain emotions or problems, and it helps you cope with particular issues or life in general. Any form of substance abuse is a health problem. That is, it negatively affects us physically, psychologically, and socially. It can cause cancer or stroke or heart attack. It can cause us to feel sad and lonely. 1 in 4 U.S. deaths can be attributed to alcohol, tobacco, or illicit drug use. 16,000 deaths annually are due to illicit drug use. This is not counting the fact that substance abuse is indirectly associated with deaths from diseases such as HIV/AIDS, hepatitis, tuberculosis, homicides, and other violent crimes and incidental injuries. Tobacco users run the biggest risk of harm since the majority of those deaths are associated with smoking. Excessive alcohol use is responsible for over 100,000 deaths annually. The economic burden of substance abuse to the U.S. economy is estimated at $414 billion every year. Alcohol abuse alone costs nearly $166 billion each year. Illicit drug users make over 527,000 costly emergency room visits each year for drug-related problems. $1 out of every $14 of the nation's healthcare bill is spent to treat those suffering from smoking-related illnesses. Healthcare costs for employees with alcohol abuse problems cost nearly twice as much as those of other employees. Drug offenders account for more than 1/3 of the growth in the state prison population, and more than 80% of the increase in the number of federal prison inmates since 1985. More than 75% of domestic violence victims report that their assailant had been drinking or using illicit drugs at the time of the incident. Children from families with substance abuse parents are more likely to have problems with delinquency, poor school performance, and emotional difficulties than their peers from homes without substance abuse. Children whose parents smoke are more likely to develop ear infections and asthma, and to miss 1/3 more school days than their peers who live in smoke-free homes. Heavy alcohol and illicit drug use is highest among construction and food service workers. Auto mechanics, laborers, and light truck drivers are among several populations that are more susceptible to alcohol abuse. By 8th grade, 52% of teenagers have consumed alcohol, 41% have smoked cigarettes, and 20% have used marijuana. Men are 4 times more likely to be heavy drinkers and 1.3 times more likely to smoke a pack of cigarettes per day. Men are also twice as likely to engage in regular marijuana use. Heroin and cocaine account for about 70% of all drug cases. Compared to the total population, alcohol-related motor vehicle fatality rates are particularly high for Native Americans. African Americans, Hispanics, Native Americans, and Alaskan Natives have higher death rates for cirrhosis of the liver relative to the total population. Alcohol mortality rates are highest for African American men, even though alcohol use tends to be more moderate for African Americans than for whites or Hispanics. African Americans are more likely to report using illegal drugs on a weekly basis than any other ethnic group. Hispanics are most likely to engage in heavy alcohol use, followed by whites and African Americans. Among smokers, whites smoke more cigarettes per day than any other racial or ethnic group. Among high school seniors, 36% of whites are heavy alcohol users compared to 29% of Hispanics and 12% of African Americans. The prevalence of tobacco use among gay men and lesbians is dramatically higher than among the general population. In a household-based survey, 41.5% of gay men were identified as smokers, compared to 26.6% of men in the general population. 2 times as many lesbian women as heterosexual women smoke. Surveys indicate that 6 to 11% of elderly patients admitted to hospitals exhibit symptoms of alcoholism, as do 20% of elderly patients in psychiatric wards and 14% of elderly patients in emergency rooms. The prevalence of problem drinking in nursing homes is as high as 49% in some studies. Late onset alcohol problems also occur in some retirement communities, where drinking at social gatherings is often the norm. For American women aged 60 and over, substance abuse and addiction to cigarettes, alcohol, and psychoactive prescription drugs are at epidemic levels. One report found that women over 59 are susceptible to abuse and addiction to these substances because they get addicted faster when using smaller amounts than any other group. 1.8 million older women are addicted to or abuse alcohol. 2.8 million abuse are addicted to psychoactive prescription drugs. And 4.4 million smoke cigarettes.